Welcome, everybody. We're just getting started, letting people join us. We'll probably get, Kelly will start the presentation a few minutes after 2 o'clock. Thank you, everybody, for coming. It's great to see so many familiar names in the attendee list and new names. Welcome, everybody who's joining us. We're just waiting for more people to arrive, and we'll get started a little bit after 2 o'clock. For those who are just joining, we're giving everybody a couple minutes to join us and get situated, and Kelly and Murray will start a couple minutes after 2 o'clock. All right, we're about to get started. We're going to give everybody 1 or 2 more minutes to join. It's just 2 o'clock now. Hey, well, I'll pass it over to you, Kelly, to get started.
Thank you. We were watching the number go up. It's like a slot machine. It's so nice to have all of you on this virtual presentation. My name is Kelly Murray. I'm a supervising attorney at the Evelyn Frank Legal Resources Program. And Rebecca is my handy dandy tech support, along with will be helping answer any of your questions that you may have during the presentation. I'm so excited that you've all joined us so that we can talk about Medicare Part D annual election for next year. So just some housekeeping rules. Please, up front on top, you'll see your Q&A tab. If you could just type in any questions that you may have during the presentation, Rebecca will be answering those as we go along, and we'll be sharing the questions that we're receiving so that all can benefit from that. If you would prefer to ask your question verbally, we are going to let you know that this is our first Zoom presentation, as NYLAG has just moved to this platform. So we're learning as we go along. So we believe that there might be a raise hand function on Zoom, and Rebecca will unmute you at the end so that your questions can be asked verbally. We also ask for your patience. As I've explained, this is the first time we're using this Zoom presentation. Your slides will be provided after the presentation, as we have everyone's emails, so we will be sending you a copy of this presentation. And finally, the presentation is being recorded with the goal to be added to our Health Access website so that all can benefit from what I will be sharing with you today. So a little bit about NYLAG, the New York Legal Assistance Group. Is a civil legal service organization that's combating economic, racial, and social injustice by advocating for people experiencing poverty or are in crisis. And our services include free civil legal services, financial empowerment and counseling, impact litigation, policy advocacy, and community partnerships. As I said, we are a civil legal service organization that focuses on many different topic areas. And our particular unit is the Evelyn Frank Legal Resources Program. We focus in on assisting and fighting for seniors and people with disabilities to ensure that they have access to healthcare and home care services that allow them to age in place in their home and within the community. To meet those goals, we provide our assistance with a combination of tools through direct representation, policy advocacy, and public education, which are currently taking place in. We counsel individuals on Medicare, Medicaid, and home care eligibility and services. We train legal, social services, and healthcare professionals about the changes in healthcare programs and how best to serve and meet the needs of their clients and the health and long-term care needs of seniors and the disabled population. We represent clients in denials and reductions of Medicaid, Medicare Savings Program, and Medicaid home care, and we assist clients with accessing Medicaid home care through the Managed Long-Term Care Plan. Our pride and joy is our Health Access website. This is a way in which we are able to educate the people, the public, on many different topics related to Medicaid and Medicare. So after this presentation, if you want to check to make sure that everything I said to you is correct, you can double check by going into that website, and you'll see the tab down here that says Medicare Part D. Click it on and it'll confirm hopefully everything that I've said is correct. In addition, it will tell you any policy updates. It has consumer materials, and it provides you a whole bunch of information in regards to criteria and eligibility. It's my favorite website. Before I got to NYLAG, this is how I learned everything. So what is the reason that you're here today? The reason that you're here is that it's Medicare Open Enrollment. And everybody's like, well, what does that mean? Other than that, your television commercials are now all about Medicare managed care plans. The reason for that is it's open enrollment. Open enrollment is any time between October 15th and December 7th, where all Medicare recipients have the ability to either enroll into a Part D or a Medicare Advantage plan, either first enrolling into it or switching from either a Part D plan or a Medicare Advantage into the other, or just switching between your current plan to a new Part D plan or a Medicare Advantage. During this time, people will have access to the information of all plans that will be offered in 2024, and the coverage, if the person switch, will be effective as of January 1, 2024. There are many Medicare recipients who this is their only shot to switch. If they don't switch, they may be locked in if we cannot find them a special enrollment to move them. So that's why we try to educate the population during this time so that they don't miss their opportunity. I'd like to just go through what Medicare is in a refresher, because sometimes people just need to build that foundation once again and be reminded about what Medicare is. So Medicare is a program through the federal government. It's administered through the U.S. Center for Medicare and Medicaid Services, or CMS. It's Medicare Part A and B. It's also referred to as Part A and B. And then people who are eligible to receive this would be anyone who's over the age of 65, or a person who's under the age of 65 with a disability and has either received 24 months of Social Security disability or have been diagnosed with Lou Gehrig's or ALS or end-stage renal disease. In addition, they would have to meet a citizenship requirement of either being a U.S. citizen or a legal alien resident living in the United States for at least 5 years. And then either to be fully insured, they would have to have a work history of at least 40 quarters of coverage. If they don't have 40 quarters of coverage through a work history, they may have to pay into Medicare Part A. Medicare itself is broken up into parts because they like to make this a little confusing. So you have Medicare Part A, Part B, Part D is drugs, or Part C. And when I go through this, you'll understand why I went A, B, D, and then C. So Medicare Part A and B. Medicare A is going to be your hospital insurance. You go into the hospital, it's the physical building of the hospital, and it's going to pay for your care while there. Not necessarily all the doctor care, but it's going to pay for you physically being in the hospital. It will be subject to a deductible or copayment, and Part A is usually free for most individuals. Part B is your supplemental Medicare insurance. It's going to cover all your doctors, your outpatient services, your durable medical equipment, your lab tests. If you go into the emergency room and you're not admitted, your mental health and your ambulance's ride. So anything that's regarding a medical care that is needed. Medicare Part C is not actually a part. It's just, I think they just wanted to add that C was next. C is a Medicare Advantage plan. It's no actual benefit packet. It's just a combination of A and B. It's not administered through the red, white, and blue card that you saw in the first slide, but it would be administered through a managed care or through another insurance company. So if you see the word Advantage, just remember that equals a managed care model through an insurance company. Once again, it will offer Parts A and B, and many of them may offer some supplemental benefits. There are different models and cost structures. However, the main ones would be your HMO, your health maintenance organization. You must go in network. There will be no out-of-network coverage options. Your PPO, which is your preferred provider, you may go out of network, but at a greater cost. And then you've got your special needs plans, such as dual eligible. I have Medicaid and Medicare, or iSNP for people in nursing home, or CSNP for people who have certain medical chronic conditions. As of 2023, it's been determined that more people are insured through a Medicare Advantage plan using Part C. It has gradually increased, and probably one of the reasons for that is if you were home yesterday and you turned on the TV during the afternoon, about 90% of the commercials are about managed care. Then we have Part D. What is Part D? It's prescription drug coverage. It's the easiest to remember. D equals drugs. People who are able to get this must have either A or B, or A and B. And then a person can enroll either in a standalone prescription drug plan or a Medicare Advantage plan with prescription drugs. But I will get to that later on in the presentation. And once again, it's going to cover your drug coverage. It is offered through a private health insurance, and those payments do not, and any of the billing from the pharmacy will go through that insurance company and not CMS. So I've given you a foundation of what Medicare is. Now I'm going to just remind you that not everybody on Medicare gets the coverage in the same way. And most people not even sure how they get it. So your first option is the red, white, and blue card. That's your original Medicare. I've got A and B. It doesn't have any networks, doesn't have referrals, not many prior authorizations. Your higher expensive radiology tests, you'll probably get an authorization, but most of them will not require you to do that. That's your red, white, and blue card, or your original Medicare. Some people have what they call optional coverage that goes hand in hand with your red, white, and blue card, called a Medicare supplement or a Medigap. A Medigap is a supplement to A and B. It will wrap around the coverage and be secondary. So Medicare may cover up to, of a $1,000 bill, may cover up to $750. Some individuals may opt to enroll and pay a premium to enroll into this product of a Medicare supplement or a Medigap that may cover the leftover balance so that they will not have to pay for it out of pocket. It will only cover any services that Medicare has approved. It does not work with a Medicare Advantage. If a person was to purchase it now and didn't have supplemental coverage or didn't have employer coverage, it may have a waiting period. It will depend on the actual plan that you purchase. Within the Medigap structure, we already have A, B, C, and D through Medicare. We're going to go back to the beginning of the alphabet, and we're going to go through several different letters. Each of those letters will be a standardized coverage depending on the letter that you opt to purchase. There will be different insurance companies within that particular letter of the Medigap that can charge whatever monthly premium they deem is necessary. We have provided links, so when you get a copy of the presentation, you'll be able to look at it. Doesn't matter if you buy the more expensive, the actual coverage and how it covers what is not paid for by Medicare will be determined by the letter. In New York State, you can enroll in this type of coverage at any point. However, just remember, some may be subject to a waiting period. So that's your option one, your red, white, and blue card, and maybe a Medigap policy. Option two is your Medicare Advantage. It covers Part A and B. Sometimes D is in drugs. It's through an insurance company. You will need to stay within a provider network. And unless you get a preferred provider or the coverage allows you to go out of network, you will probably need referrals and prior authorizations. So you may be becoming best friends with your primary care doctor, who then refers you to specialists. And you will need to go through the insurance company's utilization management rules. Under this policy, under this type of product, you are not allowed to do a Medicare coverage plan. Medicare Advantage does have the same benefits as original Medicare Part A and B and D. And once again, it can add supplemental benefits. The costs are going to vary depending on the insurance company. Some Medicare Advantages may have additional premiums in addition to your Part B, coinsurance, deductibles. It does not have to be exactly the same as original Medicare, but actuarially equivalent. When you're looking at CMS's information about Medicare and you, it does emphasize that your Medicare Advantage's premiums are lower, but that may not be true if everybody has to pay Medicare Part B. That's not what should bring you to doing an Advantage plan. Because costs may not, it may be cheaper, but you may not have access to your doctors or the services you want. They must have networks within a certain area. The network capacity, the time and distance has been diluted through the last couple of years. So you may be traveling further to get to your doctors. And it does allow telehealth to meet that requirement. Prior to 2019, you'll notice, prior to 2019, each insurance companies, if they had more than one plan, so, Cigna XYZ, Cigna ABC, Cigna DEF, it had to be substantially different. Now it gets a little murky because you no longer have to no longer required to make it as economically or actuarially different than the other letters. So it's getting harder and harder to compare what the difference is. So that went through your medical care. Now I'm going to go through your prescription drug coverage. Is going to depend on whether you have original Medicare or Medicare Advantage. So I went through this. Your standalone Medicare Part D is going to be your red, white, and blue card. And then you're going to have another insurance card that just says Medicare RX. That's through a private health insurance company, and you'll be following their formulary list. Or you can have a Medicare Advantage plan that combines A, B, and D all together. As I said, most people aren't even really sure what they have. So the best way to figure it out is to look at your actual insurance company, actual insurance cards. So when you open up your wallet, or when your client opens up the wallet, or whoever you're assisting, your mom and dad open up their wallets and they show you your cards, you'll be able to kind of figure out if they have a standalone Part D plan or if they're in a Medicare Advantage plan. There are individuals, however, who do not have a Part D coverage through Medicare at all. And those individuals may be union or retiree individuals. So if a person is actively working and has Medicare and they are insured through their active employer, they're not going to get Medicare Part D because their employee coverage will be credible and will be covering the prescription drug company. If a person retires, they may continue to receive retiree or continue to receive their insurance company, their union coverage. What's going to happen is they're going to need to figure out if their Medicare is called credible coverage. And if you open up the benefit book of their current coverage, it usually tells you Medicare, this is credible coverage. They won't have to worry about getting a Medicare Part D plan or being in a Medicare Advantage plan for Part D. In addition, there's veteran insurance that you won't have to worry about getting Medicare Part D. However, if a person is a retiree, has retiree insurance, has union insurance or veteran insurance, and they're like, I want to switch, I want to switch, I want to switch, they need to proceed with caution because they may be losing other health insurance it's with that particular coverage. And if they do act, they may not be able to go back to what they had before. So it gets really confusing for individuals. So when they're looking at their card, they're going to need to remember, oh, I had this from my employer. I need to speak to my employer or the human resources department or the union's representative to see what happens if I move out of this plan. And once again, if you have veterans or TRICARE for life military, you need to enroll in Medicare Part D. So before we get into our myth breaker section, just want to see if there's any questions. Well, we're good. We're good? Okay. So today I'm here to tell you that everybody believes and can't wait to get into Medicare because they think it's free. Well, here's the fact, it's not free. Sorry, I wish I could tell you it was. It would make October 15th through December 7th a whole lot easier for everyone. So with Medicare, there's several different out-of-pocket costs that a person may be paying. You have a premium, so that's your monthly membership fee, so that you too can either carry your Medicare Advantage or your red, white, and blue card and show it to the doctor. It's a set premium. The Part B premium will be set, the Part A premium set by CMS, by the federal government. And then if you're in an Advantage plan, you would be looking at what is set by the insurance company. Then there's a deductible. A deductible means that I have to pay up to X amount of dollars before that insurance will cover. It's before I can actually open the door and have that insurance company pay, or that insurance cover pay for my doctor visits. Then once I've met that deductible, I may have to pay a copay or a co-insurance. Copay would be a set amount of dollars that you would pay. A co-insurance may be a percentage of how much the cost is. Another out-of-pocket cost a person would have to keep in mind when we get to Part D is, or if you're in a Medicare Advantage, is the network. Am I seeing a network doctor, or am I using a network pharmacy? And also, is that a particular covered medication or a covered Medicare medical care or service? So here's our Medicare 2024 costs. Once again, a premium for Part A is 0 as long as you've worked 10 years in the United States. It will be higher depending on how many quarters you have worked if you have not worked up to 40 quarters, the highest amount being $505 if you're less than 30 quarters a year. Part B for 2024, the premium is going up to $174.70. However, there are some people who may pay more. One, because if their income's higher, they may have to pay an additional fee. Or two, if they did not enroll into Part B when they were first eligible to do that and did not have a reasonable explanation of why that did not happen, or an explanation in which the federal government feels is valid, then you will be paying a penalty based on your late enrollment. Then there's your deductible. For Part A, every time you go into a hospital, if you're admitted for 1 day through day 60, you will pay $1,632 for that particular admission. That's for a benefit period. So if for some reason you were admitted and 3 days later you were discharged and a week later you were readmitted, that is still considered to be a benefit, the same benefit period, because you were not out of the inpatient facility for more than 60 days. So it's $1,632 for the first 60 days. And then after that, you would pay a co-insurance of $408 for days 61 through 90. And if you were in a rehab, the first 20 days are free, and then days 21 through 100, as long as Medicare approves it, is $204. In regards to Part B, your deductible is $240. So in January, everybody restarts the clock. So if you have a doctor's visit on January 2nd, you will be subject to the deductible up to $240, which means you'll be paying your up to $240 of your bill until you reach that amount. And then after that, you'd move into your co-insurance, which basically breaks out to Medicare Part B would be paying 80%, and the individual will be paying 20%, or except if they have a Medigap Medicare supplement, or when we get further on, we'll go through the programs that will assist you with paying that 20%. So if you're in a Medicare Advantage, that pretty little chart is no longer applicable to you, other than you would have to pay your Part A and your Part B premium. But a Medicare Advantage can charge additional premiums. They might have a health fee or a drug fee, or a health premium or a drug premium listed within the plan. So that would be your Part B plus that particular premium. And then they will have copays and deductibles. It depends on the actual plan. There's many different Medicare Advantages within New York State. There's like 65 in Staten Island and 89 in Brooklyn. So that's why we don't have a pretty chart, but we'll go through later on in this presentation of where you can find that information. The one thing that the Medicare Advantage may have that original Medicare, your red, white, and blue Medicare doesn't have, is your maximum out of pocket for the year, which means once you've reached that magic number, what will happen is you will no longer be subject to any copays for the care that you're receiving. Medicare itself does have some free covered services. So you've got your preventive screening and your annual wellness exams, which came out of the Affordable Care Act. So your diabetes screening, your depression screening, your cancer screenings, your, colorectal cancer, your prostate cancer screenings, your breast cancer screenings, your mammographies, those should not have any copays and are not subject to the deductible. In addition, there's vaccinations, your Medicare Part B covered vaccinations, along with, thanks to the Inflation Reduction Act of 2022, your Medicare Part D covered vaccinations. Within the presentation, once again, when you get the copy, you'll see a link that you can link on and see all the care that you can get without any money coming out of your pocket. Also, remember, if you're getting a vaccine and it's being paid for through either your Medicare Part D or your Medicare Advantage Part D, you will not have to pay any copay for that particular shot. So I went through all your medical care, started to talk about your prescription drug coverage, but there's additional costs under your Part D. So the premium, Medicare Part D plans premiums range. You can usually find a plan less than $50. There's 15 different plans that are being offered in New York State, with the lowest monthly premium being $3.70. and the highest monthly premium being over $120. So that's how much a person would have to pay. It depends on the actual plan that a person opts to go into. Some people may pay it a little higher if they were delayed in enrolling in your Part D coverage when you were first able to do so. Each of the Medicare Part D plans may have a deductible. In 2024, the maximum amount that would be the deductible is $545. But there are many plans. There are some plans that have lower deductibles, and even some plans that have zero deductibles. Just note, when a plan has a lower deductible, usually that means you're paying a higher premium. They get it on a monthly basis instead of when you get the actual medication to pay for. In addition, Medicare Part D costs have copays, and the actual copay will depend on several different factors, including, is it on the formulary? The formulary is a list of covered medications by that particular insurance company. Each Part D plan has a formulary. They must cover at least 2 medications in each of the required classifications of medications, but they may cover, blood pressure medicine XYZ, but not blood pressure medicine ABC. It depends on the actual formulary. In addition, it may depend on if there's other, if it's in a drug tier. So Medicare has drug tiers between 1 and 6. So they did move away from the alphabet, but now it's through 1 and 6. So you go from your preferred generic to your preferred brand, to your brand, to your specialty, and then there's some other kind of classifications within tier 6 that may be your super preferred or your super specialty. It depends on how they've determined what tier 6 is. When you're going to the higher numbers, of course, the co-pays that you'll be paying will be higher. In addition, it's going to depend on your pharmacy. There's 3 types of pharmacies within Medicare. You've got your preferred, you've got your standard and network. So the first 2 are in-network providers. And then you have your out-of-network. You do not want to be going to the pharmacy on a plan if it's out of network, because that means you'll have to pay 100% of that cost of that medications. Part D plans will not allow you to go out of network. The cost between in-network, preferred, and standard will be noticeable, but would not be as deep as if you were going into an out-of-network pharmacy. Then you have stages of coverage, which we're not going to go through, but it depends if you've met your deductible, if you're in the initial, if you reached a certain amount, then you go in what they call a coverage gap. And then when you reached another amount with is higher, you go into catastrophic. Each stage has a different breakdown of how much a medication should cost. And finally, it's going to there's another control that the Medicare Part D puts in effect, and those are your utilization management. It's what you need to do. You need to jump through this hoop to get the medications you need. And that would include quantity limits, in that I will cover XYZ medication, and I will allow you to get 30 pills a month. And if you need more than 30, then your doctor and you are going to have to jump through a hoop for me to give you more than 30 particular pills. Or there's step therapy. I need XYZ, but their policy is you need to take 1, 2, 3 until or explain to us why 1, 2, 3 won't work. And then we will allow you to have XYZ. And then your last hoop you may have to jump through is a prior approval. My doctor has to explain medically why I need that particular medication for that particular condition. There are some good news under the Inflation Act of 2022. There is a Medicare Part D cost sharing maximum for individuals who are taking insulin. So the maximum amount of that particular copay will be $35. It may be less, but the maximum that the pharmacy can charge you is $35, as long as that particular insulin product is on your plan's formulary. When we get to how you can find this information, that information will be on the search that you could possibly do. Just note, if for some reason the insulin product is higher than $35, that means it's not on the plan's formulary. So it doesn't mean all insulin products are going to only cost $35. It's insulin products that are on the plan's actual formulary. Any questions?
I think you can keep going.
Okay, so our next myth is I don't have to do anything because my plan is the best and it's been working so well for me and it's not going to change. It's going to be the best plan for me in 2024. So I'm telling you here, right now, anyone who has Medicare and has prescription drug coverage and or a Medicare Advantage plan, with prescription drug coverage, you need to review it. You need to review it annually because insurance companies change their formulary. They change their in-network providers. They change the utilization management. They're going to change their copay schedule. They're going to change their premiums. So it's very important during October 15th to December 7th, everybody reviews their product, their current plan, because what's good for you now is not necessarily what's good for you on January 1st. So the reason why you want to do that is you want to make sure your prescriptions are still on the formulary. You want to make sure your pharmacy is still in the network. And you want to make sure your medications are still within the same tier. And most importantly, that your prescriptions are still affordable. Because the worst thing that can possibly happen is on January 2nd, when you walk into the pharmacy, they now tell you your medication that was costing you $35 is now $150. People have not budgeted it, so you want to make sure that you're staying within the amount that you can afford. And you want to make sure that you still have if your drugs have any restrictions. Once again, on January 2nd, you don't want to walk into your pharmacy and find out all of a sudden you need a prior authorization because you know your doctor wasn't open on January 1st, or it may have been the weekend. And you want to make sure that your plan still exists in 2024. There were 19 plans in 2023, now only 15. There were 3 basic plans that had smaller premiums. Now there's only 2. So there's a whole lot of people who are may be shocked on January 2nd. In addition, if you have a Medicare Advantage, you want to think about all of the above, and you want to make sure that your medical providers are still in network and the copays are still manageable. The reason why you want to do this is it's your time to move. Some people are going to be locked in. They're not going to have a special enrollment period. And so we want to make sure, once again, on January 2nd, you're not calling us saying, hey, I need help. I don't know what to do. We want to meet that before. We want to be proactive instead of reactive. In addition, there's some people who might get locked into their plan based on their medical needs or overuse of their medical providers and or their medications. If that was to happen, please contact us so that we can talk you through maybe possible next steps or bring it to the attention of any social worker who may be able to assist. Myth number 3. This is my favorite. My neighbor's coverage is the best option for me. Everybody's got neighbors who have great insurance. Everybody has family members that have great insurance. And all I can say is it might be great for them because health insurance is not a one-size-fits-all type of coverage. Everyone has their own medical needs. So you should not be comparing it. Your neighbor next door is not going to tell you, I have the best insurance because I have 15 diseases. I take 35 medications. Oh, yeah, I'm also on Medicaid. They're not going to tell you that. They're just going to tell you it's the best. Or they're not going to tell you, oh, by the way, I'm on my employer insurance. Nobody's really sure, and you cannot, compare. Nobody knows anyone's economic status. Nobody knows anybody's medical status or medical needs or medical preferences. Some people might like to go to the doctor down on the corner, and that doctor only takes that medication. Therefore, that insurance is the best insurance for them. So please do not just go by what your neighbor says. You need to speak with a health counselor. Myth number 4, I think I'm on 4. The name of the insurance company providing your coverage says a lot about your benefits. Absolutely not. There was a time that everybody would tell me, I want to be in Empire Blue Cross Blue Shield. That's great. Empire Blue Cross Blue Shield has thousands of particular plans, and then they would glass over And they'd be like, what are you talking about? I just want Empire Blue Cross Blue Shield. Or some people might say, I want United. Or some people might come to you and say, I have United. And you're going to look at them like, well, what does that mean? Or you go, I have United. United has thousands of products. So once again, you're going to open up your wallet and you're going to look at your insurance card, because that may help you to understand this is the type of coverage I have. But it's not going to tell me how much the doctors are. It's not going to tell me what medications are covered. You're going to need to also get your benefit package or the summary of coverage, or that big book that may be online, or you have to call to request a copy of. That's what's going to tell you your actual coverage. So I know I went through, October 15th through December 7th is the time for you to switch. There are many new products out there. There's many products that are no longer going to be offered in 2024. And you're thinking, well, that's great, but how do I find that information out? So Medicare, the CMS, the federal government has what you call the Medicare Plan Finder. It's an online tool. You're going to log on to that particular website. If you Google it, you can just do Medicare Plan Finder. Just make sure that it's when you're looking at whatever comes up in the search engine, that it says Medicare.gov, because a lot of the insurance companies have it. A lot of brokers may have websites that get you to the Medicare Plan Finder. So you want to just make sure that you're in Medicare.gov. You'll come to this particular website and you'll see your friend. So if you get onto a website and your friend is not there, no, you're not on the federal government's website. What will happen there is that it gives you the opportunity to either log on through your actual account, or you can do it as a guest. And it's going to allow you to go through a series of questions so that you can compare plans. It gives you a summary of the costs. It will give you the opportunity to see restrictions on what medications may or may not be covered, the utilization, if there's step therapy, quantity limits. And once again, it does give you so if you look on one, you can do an account. So if a person has an account, you can look there, or you could do it as a guest. If you wanted to use this site, there's certain information that you're going to want and need to make the site use it to your benefit. If you don't have this, you can still probably muddle through as long as you have the zip code. But it's not going to give you the most up-to-date information. So you're going to want the zip code, your current list of medications, which is your name, dosage, and frequency, your pharmacy preference, your Medicare account and login, if you prefer to go through that. I always recommend that you have the copy of your Medicare card and any other information or cards that you have, so you know what your current coverage is. And then information if you're enrolled in Medicaid, Extra Help, LIS, and Epic, which I'll get through in a few minutes. And if you're getting home care services through Medicaid. And then you just go step by step, and it's real. It will walk you literally through the process. It won't let you advance unless you answer the questions and you enter your personal information, meaning your zip code. Then if you have Medicaid, Medicare Savings Program, Extra Help, or if I don't know, or no, I don't, you enter your medications, you select your pharmacies, you review your search. It will allow you to do a Part D search. It will allow you to do a Medicare Advantage search. And then you do side-by-side comparisons. It will also, once you've done all your research, if you want, you can enroll right then. You can enroll using that online mechanism. If you want to learn how to actually do it, there's a YouTube video on how to use Medicare Plan Finder, and so that you won't be panicking or have any unnecessary anxiety about using that tool. So I've gone through all the different costs and I spouted different dollar amounts or different percentage amounts. And you're like, how in the world does anybody afford that? Many people can't. And if they can't, there are programs out there that may be able to assist. And these programs would include the elderly pharmaceutical insurance coverage, or EPIC. That's my favorite program to have everybody enroll in. I usually say it's kind of like going to the bagel store, and after your 10th bagel, you might get your 11th bagel free. It's your frequent flyer mile card. It's available for anyone who's over the age of 65. So you have to be 65 or older. It's for single people with income up to $75,000 or $100,000 if you're married. So yes, you heard those dollar amounts correctly. That allows a wider array of people to get this particular program. It's broken down into two different types of plans. You have the fee plan, which would mean that an individual would have to pay on a quarterly basis to EPIC to allow you to have this additional coverage or cost saving, or a deductible plan. I pay the deductible plan would mean based on whether you're in the fee plan, or the deductible plan will be based on your actual annual income. The deductible plan gives you an actual deductible. So once you've reached your Part D deductible, then you would have to reach your EPIC deductible. However, once you've reached that magic number, or you've paid your fee, your copays will decrease substantially. What I mean by that is, if you have a medication that's $120 and you're an EPIC and you've paid your fee, or you've reached your EPIC deductible, that $120 is now $20. For any prescription medication that is $55 or more, you pay $20. So it's a program that's there for you. You may not need it now, but what it also does is give you the opportunity of once a year. You won't be locked in. You can switch. So if your plan is not helping you, or you're no longer happy with your plan, or you now have a medication that's giving you prior authorization and is now more expensive, it gets you a one-time shot of getting out of that particular plan. So it's a nice get out of the drug plan I hate card. So it's available to everyone over 65 in New York, as long as you meet the income guideline. The most it will cost you is a stamp for the deductible plan. We've included a link on the PowerPoint, so when you get the presentation, you'll be able to see, or you can just do NYS EPIC, Google it, and it'll pop up, and make sure that, and you'll see the information. It'll give you it will tell you the breakdown of the copays. It's an easy application, or you can call the number and they'll talk you through it. The next program is your Federal Extra Help program. Currently in 2023, there's two levels of this particular program. Extra Help provides you with assistance with your Part D as in drug monthly premium, and or the Part D copays, and or deductible. In 2023, there was a partial extra help and a full extra help. And let's be honest, not everybody understood what the partial extra help, how it worked. So I'm happy to say, thanks to the Inflation Act of 2022, the Inflation Reduction Act of 2022, starting in January 1 of 2024, there will only be one level. Everyone up to 150% of the federal poverty level will be eligible for full extra help. That will allow you to get assistance with your premium up to the Medicare benchmark, which is about $48 in 2024, and will make your deductible zero. In addition, your copays will either be $4.15 or $10.50. It may be lower if you're in Medicaid, if you're below 100% of the federal poverty level, or if you have home care. If you have home care, or if a person you're assisting has Medicaid home care, your copays will be zero. Just a note, when you go through Plan Finder, that zero copay will not be reflected. So you just have to keep in mind if the person has Medicaid paid home care. Extra Help also assists you with giving you the opportunity or a special enrollment plan that that allows you to switch out of your Medicare Advantage plan or your Part D plan if you're not satisfied once a quarter for the first 3 quarters of the year. So if on January 2nd, the person comes to me and says, oh my God, my plan, it's not working. I now have to pay full cost for my one prescription because it's no longer covered. You find out they have Extra Help, then you would be able to get them out of that in January to be effective February 1. To apply for Extra Help that's through the federal government, there is an income and a resource guideline. The resource guideline is up to $16,630 for up to $16,660 for a single, up to $33,240 for a couple. So you would apply, and you can apply online. It's quicker. If you're working with someone and they're going to be eligible for one of the next 2 benefits and Extra Help, if you apply for Extra Help, that will happen quicker than if you apply for the MSP, the Medicare Savings Program, or Medicaid. The next program is the Medicare Savings Program in 2024. So Extra Help is through the federal government. The Medicare Savings Program will come out through New York State. There's 2 levels of coverage. There is the qualified Medicare beneficiary and the qualified one individual. There is no resource limit. However, if a person is eligible up to 150% using the Medicare Savings Program and you apply for it, a person automatically gets Extra Help even if their resources are higher. So this is the back doorway into getting Extra Help. On the 2 levels, under the qualified Medicare beneficiary, you get the Medicare Part B premium, you get Extra Help, you get Part A premium assistance. So if you're QMB and you didn't have 40 quarters of work history and you couldn't get free Part A with no premium, QMB will pay for it. It will also cover your Part A and Part B deductible. It will pay for any co-insurance, and it gives you balanced billing protection. So if a doctor has agreed to accept and contract with Medicare, and the individual is in the QMB program, they are not allowed to balance bill the individual, so the person should have no copay or co-insurance. Medicare itself has done a big push educating providers about this. However, there still seems to be some gaps. So if for some reason someone is being improperly billed for that, please reach out to either us or any HICAP counselors in New York State or Medicare itself, and they will be able to explain this to you and provide you with tools on how to let the provider know. Under QMB, you are allowed to have a spend down, and you are allowed to have QMB and Medicaid. And you can just disregard that. The next slide will provide you information because it won't. Sorry. But you could look at our website for that information. And then the higher level is your QI1. This would be anyone between 138% to 150% of the federal poverty level. And that will basically be giving you Part B premium assistance and Extra Help. It will not give you any balanced billing protection, and it will not provide you with any premium, Part A premium assistance or assistance with the deductibles or co-insurance. However, it does allow you to get Extra Help. Finally, the last program that may be able to assist you is Medicaid. Medicaid is insurance that comes through New York State, and it allows you to reduce or eliminate your Medicare deductible and copays. It has an income and a resource guideline. And it does, in addition, provide additional assistance with maybe services that are not necessarily covered by Medicare, which may include non-emergency transportation, dental work, home care, hearing, and eyeglasses. With Medicaid, a person does also get extra help automatically. The good thing is now in New York State, Medicaid's income guideline is now equal with the QMB income guidelines. So when you're applying for both programs, you should be automatically deemed eligible for both. Once again, you have your Medigap policies that a person can look into paying for. A Medigap policy is quite expensive. The monthly premium may cost anywhere between $150 and $360 for that. Just so you know, if a person is applying for the Medicare Savings Program or Medicaid, when they're determining a person's eligibility, any health insurance that a person is paying for, except for Part B or Part D, can be used as a deductible. So if a person has a Medigap policy, they may be able to use that deductible to be deemed eligible for either the Medicare Savings Program or Medicaid. Finally, unfortunately, Medicare scams are currently on the rise.
Kelly, I just want to give you a heads up on the time because I think this webinar may end exactly at 3 o'clock. So
Okay.
just be prepared because I know you're coming to the end, but be prepared.
Okay.
Yeah.
So, unfortunately, there are terrible people in the world. So scammers are taking advantage of confusion that comes with Medicare enrollment, also the Medicaid winding. So just be aware, Medicare will never call you. Medicare will never request for you to pay for their services or threaten to cancel your insurance during a phone call. Please be skeptical of providing your personal information to anyone. If you are at a health fair or marketing event and you fill out whatever card it is so you can be in the raffle so that you can get the $50 gift card to Dunkin' Donuts, you've just given them permission to call you. So please be cognizant of that information. Also, no one should be pressuring you. You have until December 7th to make decisions. So if your gut is telling you this call makes no sense, tell them, please provide me that information in writing. You have my address, and hang up. They'll send it to you if they really have your address. If not, they won't. Don't answer any calls from numbers you don't know. If you do believe that you've been scammed, here are some numbers. Your 1-800-Medicare. There's the Senior Medicare Patrol resources, and you can always call the FTC. And finally, I know that I gave you a lot of information, and I know I gave it to you quickly because I talk really fast. So don't panic. Here's our intake information. EFLRP has intake via phone on Mondays, 10 a.m. to 2 p.m. or our email. If you're in New York City, you can also call 311 and ask for Medicare assistance. They're going to get you to any high-cap counselor or any program that they've worked with in regards to Medicare. If you want to go to someone other than us, it's fine. We understand. We like to share the wealth with others. Everybody is just as knowledgeable as us. If for some reason you're not in New York City or in New York State and you want to find a state insurance counselor, you can call that number and say Medicare, or go to that website of shiphelp.org, and they'll get you to their health insurance counselors that you will not have to pay any amount of money for their assistance. So I don't know if we have any questions. I did it.
3 o'clock. It looks like we might have a minute. I know people are going to have to leave because the hour is up, but there's one interesting question here, which was, what would you say to a Medicare beneficiary who has parts A and B but doesn't have any additional coverage, no Medigap, no Part D. And instead, they're just using GoodRx to defray prescription drug costs when they go to the pharmacy.
Okay, so my advice is they need to get a Part D plan. They need to do it as quickly as possible. Even if the person is not taking medications, there's one for $3.70. You want to be in Part D because for every month that you don't have it, you're going to be assessed a penalty. So that will give you that. Good
Is there
RX.
a way to get rid of that penalty?
Sure. So we can see if the person's eligible for Medicaid or Medicare savings program or extra help. Once you've been deemed for any of that, your Part D premium will be erased and someone other than the individual will be paying that premium. But you need to get it because GoodRx might work now, but God forbid you start needing expensive medications, it's not going to work.
Someone writes that they have maybe their clients, or they ask, why is Medicaid now sending out these letters that you'll lose your Medicare if you're not enrolled in a prescription Part D plan?
So whenever a person gets enrolled into Medicaid, they must have all the other insurance that they're required to take all other insurances. All other insurance includes Medicare Part A, Part B, and Part D. Part D is what is actually going to pay for the individual's medications, not Medicaid. So this is a reminder that you need to enroll. If you are eligible for Medicaid, and if for some reason you don't enroll, you will get enrolled into extra help, and extra help is going to auto enroll you into a plan. Anyhow, one of the low income subsidy plans or your benchmark plans, but you want to make sure that those particular plans meet your needs. But it's a reminder that a person on Medicaid that cannot be their only coverage now that the public health emergency is over, they must have all parts of Medicare.
And one last question. Are you aware of any logical standard for a pharmacy being preferred versus standard?
I have no insight to an insurance plan's business practice of why they contract with any particular pharmacy in any given year. I can tell you CVS used to be a preferred provider in a lot, and this year they're not. So rhyme or reason of how an insurance company works, I don't have that one.
All right, that's our question. We're getting lots of thank yous. So thank you, Kelly, for that great presentation, and I will be signing off.
Have a great day, everybody. Don't forget to do your open enrollment.